这5分钟下来。因为呢，我在来的时候呢，其实很多人跟我讲说，我们想要跟大人哥一起合影，是我们心目中的英雄。
with a total of over 61 million confirmed cases and over 1.4 million deaths, with the United States as being the most devastatingly hurt country, over 0.2 million deaths. That's over 2% of death numbers. In Taiwan, we have 639 confirmed cases and only 7 deaths. So the mortality rate is 1.1%. And with only 55 cases or local cases, local infections, with only 10 unknown sources of infection. So relatively, Taiwan has done a great job fighting the virus. If we compare the world's numbers with the United States and Taiwan, we can look at the incidence rate and the mortality rate. Globally, it's 786.2 globally. With the United States, it's every 100,000 people is 3,992.8. In Taiwan, it's 2.6. And we can look at the mortality rate on the screen. So I would like to thank a lot of unsung heroes who fought with the virus behind the scenes. So we can see that Taiwan is actually ranked 209th among 218 countries and areas in terms of confirmed cases per 100,000 people. As we know, as the pandemic hit, once they hit, it does not only affect our health, but also sustainable development goals of the world. And all of them, 17 of them, including poverty, hunger, good health and well-being, quality education, gender equality, all the way till the 17th, they are all affected by COVID-19. Probably the number 14 to number 15's life below water and life on land, they are improved because they are the wildlife. But our budgets for taking care of the wildlife is also affected. In other words, fighting with COVID-19 is a disaster relief. What is a crisis? By definition, it's a disruptive and unexpected event that threatens to harm the organization or its stakeholders. That's COVID-19. It does not only affect one organization or a country, but the whole world. And it is highly dangerous and difficult to deal with. But also, we often said that crisis is danger plus opportunity. And a crisis can be a turning point for the old paradigm or old system to innovate and make a change. There are four elements of a crisis. There are threat, surprise, short decision time, and a need for change. So with these four elements, we need to make good decisions in a very short period of time. And we also need to make changes. And these four apply to all crisis managements. Surely, for this process, it's great to signal detection, to anticipate or to forecast what might happen and to contain the crisis when it's still little or when it's still manageable or containable. Last year, Wuhan was able if Wuhan were able to contain the virus in the city, had a lockdown, then it wouldn't spread across the world. But the early signs were not, unfortunately, detected. For the second point, preparation and prevention are also critical. Once they happen, still we need to contain and do damage control. After which, for the recovery of the businesses, that is very critical too. And finally, we need to learn something from the lessons. Taiwan has faced and dealt with a lot of natural disasters and crisis. In terms of crisis management, for your participation and all the government agencies' participation for crisis leadership, I would say we have been improving in this regard. As a great leader in this area, what should we do? First of all, we should build an environment of trust with mutual trust. In other words, these great leaders in the academia, the governments, the private sectors, they need to be with integrity and positive intent. They need to be very capable and mutually respect each other and also uphold the spirit of transparency. Second of all, we need to reform the organization's mindset. Next, we need to identify obvious and obscure vulnerabilities of the organization and make good management of them. Next, we need to make wise and rapid decisions as well as taking courageous actions. Finally, learn from crisis and to affect change. In fact, for Taiwan's experience, we've learned from challenges. Challenges or ordeals can be stepping stones for us to learn, to improve. COVID-19, to be honest, could land, actually, we landed a lot of experience from 2003 SARS, happened in Taiwan, and all the way till H1N1 swine flu. So we could improve and become better and better. So our CDC staff actually said we didn't just prepare for one day, we have been preparing for 17 years so as to have this successful fight. So with the accumulation of experience, we can survive and contain crisis more successfully. And I wouldn't want to be the only person who's been boasting or talking about the advantages of us. But according to Bloomberg Economics, they look at emerging economies and look at how much affected they are by COVID-19 in terms of the confirmed death from COVID-19. That's first of all. And the second of all, this level of activity compared with pre-virus normal. And finally, the policy space available to counter the damage. According to Bloomberg Economics, that's from July 20th, in 75 countries, Taiwan was ranked number 1, followed by Botswana, South Korea, and Thailand. So on July 20th, Taiwan was recognized as a great performer in this area. And according to News Japan, they look at epidemic damage and economic damage with a full score of 200 among 49 countries. Taiwan is here with 180 points, that's number 1, followed by Malaysia, Hong Kong, Thailand, and China. From here, we can say that Taiwan contained COVID-19 quite well. As of September 20th, according to the British source, Our World in Data, they presented this percentage decline of GDP in the second quarter of 2020, that's this year. Taiwan was the lowest decline of 0.6% decline, and South Korea is with 3% decline. As you can see, Peru is with 30.2% decline economically. And economically, we are with one of the lowest declines. Then many people were discussing whether we should have a lockdown, that is to reduce people's in-person contact, and also we have to reduce economic activity as well. But then the answer was no. As you can see, Peru is with the lowest economic, the highest economic decline, but Taiwan is with the lowest economic decline, and also we are successful for the containment of COVID-19. So lockdown is actually not a very good strategy. So how did Taiwan do it? I said precise containment. I will talk more about precise containment later on. And to no surprise or to no coincidence, from the United States NBER, that's National Bureau of Economic Research, they actually have cultivated 16 Nobel Prize winners. I wouldn't say they're wonderful, they are actually great. So it's like the British source, our world in data. This NBER data shows that with the higher death rates, they are also with the most terrible or the serious economic decline. But they have to highlight a country that's with a very low economic decline and also successful containment. That's Taiwan. We were at the time one of the only countries with economic growth. Our government even said we can expected to have a 2.6% economic growth. People wonder how we could do it. So, globally, it was a failure in terms of pandemic containment. As we said that in the beginning we should have signal detection, but then we had inadequate contact tracing and tracking resulted in the outbreak and city lockdown in Wuhan. That's from last December. At the time, they didn't have contact tracing. Later, I will talk about precise tracing and tracking. So, what was the result? I mean, if we were to have very precise contact tracing, then we can contain the crisis because the patients will be all in the hospitals instead of going everywhere. And the postponed announcement of the public health emergency is also one of the reasons for the failure. Because as of January, it's already quite late, we can say. As of January 22nd, the WHO even said it was not very serious. Personally, I think the WHO failed in two aspects. One of them is professionalism. On January 22nd, actually, many experts said that we should make an announcement. And the second problem with them is political neutrality. For example, when we are facing this pandemic, our CDC insisted to have political neutrality and we follow professionalism because they are so critical for COVID-19 containment. Most countries by February did not control the border to decline visitors and travelers from mainland China. While many countries had lockdowns already, yet they did not promote personal hygiene and social distancing, not to mention people's gatherings. That is not yet effective enough. Next up, we see mass screening, but it's without enforcement of 14-day isolation and quarantine. Is that really effective if I do a mass screening and we are all tested negative? But then tomorrow or the next day, one of us might be tested positive. So we cannot only do mass screening. After the mass screening, we need to do isolation and quarantine. In Taiwan, we had this policy of precise screening and precise testing. It's effective and also efficient. And number 7, We see personal protection equipments lacking. People have this hoarding problem, and panic buying resulted in shortages of PPEs. And also we see disinformation disseminated. For COVID-19, disinformation dissemination, it will cause a lot of troubles, of course. And finally, the final factor is the lack of professionalism and political neutrality, as I mentioned.
In fact, in the pandemic preventions and containment policy in Taiwan, we actually started to prepare since 2003. Back in 2003, when we had the SARS pandemic, we had 346 people infected and 37 dead. It was a devastating situation back in 2003. At that time, our president and premier, by May 18 that year, that we have 6 hospitals. So at that time, they assigned me on May 18, 2003 to be the national health ministers. And over the 28 days, we have contained all the hospital infection cases, and we have all have comprehensive route plans in the hospitals. And that's a very devastating learnings and experiences we have back in 2003. So after this experience, we learn from the disaster management theories and learn from all these experiences. So after that experience, we amend the Communicable Disease Control Act and relevant regulations, and we also restructuring the Ministry of Health and Taiwan CDC. At that time, in CDC, we have civil servants, medical professionals, and nursing professionals, and experts as well. And Taiwan CDC also offer higher and better compensation packages to these doctors and participants. We also have certain isolations hospitals, and that is designated to control all these communicable diseases. Every year, we also have evaluations for hospital, so they can verify whether their containment policy are effective or not. We also have a very stringent border control and quarantine procedures. We also establish a national health command center. So, if we encounter any emergent communicable diseases, we can initiate the center effectively and efficiently. And the commanders in the center, as well as the scholars and experts panels, should be politically neutral without any political influence. They may be scientific um, experts as well as scientist based. The reason why we are performing better in this pandemic is because we do have prudent actions and rapid response, early deployments, and transparency. These are all the principles that we have done after SARS. At the end of last year's, our CDC deputy director noticed the potential pneumonia situation happening in Wuhan. So we informed WHO as well as CDC in China about the situation. However, WHO didn't have rapid response to our message. But since then, we continue to enhance our border control. We have all the onboard screenings for the flights between Taipei and Wuhan. And we also have reviewed the hospital infection control system. We had the advisory committee, and we also requested on-site visit to Wuhan. They went to Wuhan by January 11th, and after return, they confirmed that we should have taken earlier response, and we did take earlier response, and that's why in January we have started the travel notice. Unfortunately, after WHO was informed by our messages, they didn't take quick response. And this is from the New England Medical Journal, and you can see from this journal and this article, um, actually before January, there were over 30 serious patients living in the ICU in Wuhan. So what about their families? What about their colleagues and classmates? Because these relatives and these people around them didn't have serious symptoms. So they actually stay in their homes and continue to spread the virus across the public arenas and public areas. As we have seen that this times we have a lot of um, patients who are asymptoms or mild symptoms. That's why it is important for us to track all the people who have the potential to be infected by the disease, and that's what we call the precision tracking systems. Let me give you a test. Over the past 14 days, if you have any close contacts, please write down all the names that you have close contacts within 1.5 meters over the past 14 days. It will be difficult for everyone to do so. So how do we do the precision tracking system? As we have said before, that back in January, that we have announced the class 5 infectious disease. So WHO at that time confirmed that this virus may be limited human to human transmission. The Taiwan National Security Council have an emergency meeting on January 22nd, and WHO also had an emergency meeting, but they didn't take any actions. They only take a PHPIC by January 30. When the presidents organized the emergency meetings in January, and they asked us to learn from the SARS experience in 2003. And back then, we told them that we didn't have sufficient face masks at that time. So after that, the Ministry of Economic Affairs increased the capacity and the productivities to 23 million pieces a day, and it was, of course, we have outstanding quality with all these PPEs, and we also have 71 face mask producers participating in the process. We also told our presidents that back in 2003, it was difficult for us to track all the close contacts. So now, if we want to trace the close contact, you can look at their smartphones and see any kind of messages, text messages, and then you can remember where you have been over the past 14 days. Through this process, and we have mostly confirmed cases imported from other countries. And through this process, we identify over 10,000 close contacts in the process. So that means that every person may have 20 close contacts on average. So if you can identify close contacts of 20 people, you probably need to think very hard, but with your smartphone, it will be easier and helpful for you. At that times, we have requested a lot of people to do isolations and quarantine. And we are also using the power of smartphone as well to track their GPS signals. So it is basically a digital fence. So once your phones leave your residence, then people will visit them. If they're old people do not have smartphones, we will give them a free one. So as long as you, for the older people, they can use the feature of facial recognition, and they can directly communicate with phones via audio control. They do not need to key in informations. So they can do voice recognitions and facial recognitions. These are the ICT and the latest technologies as well as artificial intelligence. So we can minimize the burden for us to trace and track all the people who are suspected or confirmed cases. So it is important for us to utilize new technologies in the process to do the tracking. I will not go into details into this page because we have already mentioned about border control, and we also test all suspects. We are doing precision screening instead of mass screenings. We also mandate reporting of confirmed cases and trace all the close contacts. And for all the close contacts, they need to isolate themselves for 14 days, and inbound passengers have to quarantine for 14 days. At the same time, we provide them support and care services. We promote personal hygiene, social distancing, wear face masks. We also provide financial relief to affected families and industries. We also have economic stimulus packages. And we also increase domestic investments. We will tell you more about this later. In the pandemic process, we emphasize that we do not do lockdowns, we do not do mass screenings, but we are using AI and smart technologies to enhance the surveillance. We also announce travel warning quickly with cellular broadcast to everyone. Probably you remember a cruise ship, Diamond Princess, back in Kilo, and at that time, more than 2,000 passengers traveled around northern Taiwan, and we identified 60 hotspots. And once we identify the hotspots, we track the GPS systems, and then we send out the cellular broadcast. At that time, we sent out about 600,000 text messages to people who have been to all these hotspots. So if you have received them, that means that you were in the hotspots in the past on that day. And we also probably remember that we have 24 military people being infected. Uh, so at that time, we also sent out 200,000 text messages to people who have been to these hotspots places. So we are using smart technologies and AI technologies to enhance our control. In the process, we are using very smart technologies and smart methods to elevate the results. So here you can see the timeline that you are people from China, Hong Kong, and Macau are temporarily prohibited from entering Taiwan starting from February 11th, and all the passengers have to go through the tracking systems, and we also use mobile applications. We also have deploy all the uh, designated taxis to the quarantine places. These are all the inbound passengers mechanism that we have. If you have close contacts with confirmed cases, then all these people will have to do home isolation for 14 days. And we have the electronic security monitoring system. These are the mobile applications that we are using and digital fencing tracking systems. On the right hand side, you can see that for users, they can use facial recognitions and voice recognitions. So many people are actually attracted by all these process, and then they are convinced that this will be effective. Of course, it will be very difficult for them to be isolated or quarantined for 14 days. So we have different care services and support for them. We help them to collect garbages. We deliver meal for them. We also send them to hospital when they feel uncomfortable. These are all the support and care services we have for quarantine people. So how many people did we quarantine? By November 12th, we have 1,100 and 329 people who had home isolations, and we have more than 370,000 people under home quarantine for 14 days. And during the process, we actually fined about 1,000 people. That means that 99.7% of these people under home quarantine actually stay at home for 14 days. They sacrifice 14 days of freedom so all the people in Taiwan can continue to work and study and do everything as usual. So I think that we do have higher civil ethics in the process in Taiwan.
所以呢，
It is also very important, of course, to have early deployment or preparation. Our daily press briefings are with the highest reception ratings at the time, the most popular programs of all time at the time. And also we had adequate supply of PPEs and other medical materials, and also we promote personal hygiene and social distancing. They are all very important for COVID-19 containment. Now we can look at the masks. When it when we first began, it was not enough. The number was too low, so we had to have a rationing system. So we have to use the national health insurance card, so the NHI card. We have to make it as affordable as possible for every citizen. Just like for the 921 earthquake, I was serving in Taida, the National Taiwan University. We went to Puli, the earthquake hit place, to take care of the affected people. So then we had to come up with a face mask map. I think Audrey Tang, our digital minister, and Chen Qimai, another minister, were the victims of my plan because they had to come up with a plan for a face mask map. And many people, especially the Japanese, they were so surprised and impressed by the map, especially the Japanese. So our digital minister is like a star in Japan now. And now, as we have enough amount of masks, we donate masks to other countries. We donate countries to over 80 masks to over 80 countries. And we donated over 54 million masks to Europe, United States, and our diplomatic allies. For our announcements, it has to be not just in Chinese, but also in different languages for the users of them, especially that we have a lot of migrant workers. The amount of that, the amount of which is exceeding the population of indigenous peoples in Taiwan. As for the promotion and encouragement for social distancing, we should have, like Audrey Tang, our digital minister, said, it has to be with three elements. It has to be fast, fair, and fun. So it's not just an announcement. It has to be fun. It has to be sometimes humorous, so as to be memorable. And now we see a general public practicing social distancing in some pictures, and the Taiwanese citizens are having very good compliance. And with our national health insurance system, we can have this travel history and also the e-mask 2.0 system in place readily. For all the doctors and physicians, they can check the patient's history within the system and know their travel history. We also have developed many platforms using AI, artificial intelligence, including a social distancing app. It's with Bluetooth technology, and the health report app that's with voice recognition and facial recognition and automatic filled in. and so on. Of course, COVID-19 has caused a damage on economic development. The shocked industries include transportation, tourism, physical entertainment, physical retailing, and food and beverages. Of course, there are some other industries on the other hand, they are with advantages. It's healthcare and epidemic prevention industry, and also the stay in the house otaku economy, and also like food delivery, convenience store deliveries, and so on. In terms of online consumption or digital consumption or purchase, it's accelerated. So we can say that digital transformation was accelerated because of COVID-19. Also, we provided financial aid to low income and vulnerable groups. While we also have stimulus vouchers for every citizen, please make good use of them so we can have great purchase and great economic growth. We will look back and check if it worked. The government spent 410 billion Taiwan dollars budget for epidemic control and financial relief and economic vitality. The government shifted spending priorities to emergency measures and increased government investment and procurement for expansion of domestic demand. The government also helped acceleration of foreign and private investment and maintained foreign exchange market stability and stock market momentum. Finally, and also very importantly, the government issued stimulus vouchers for each citizen to spur consumption. What's the result of this investment? Starting from August, in terms of retailing and F&B, food and beverages, and also those small eats, they are having positive growth economically. What's Taiwan value in this regard? That is democracy, transparency, and solidarity. As I mentioned, the government decided to open access to COVID-19 information to each and every citizen. And we had daily press briefings. Very quickly, the Central Epidemic Command Center, CECC, quickly established its authority and earned the trust of the public. With the trust of the public, we were able to influence on society, encouraging citizens to follow government guidance and rules, and making the public less vulnerable to disinformation campaigns. So we can say it's a virtuous cycle. The better the public policies are, the more authority the CECC has, and people follow, people trust the government, then we have this virtuous cycle because as a result, we will have a better containment of the virus. So Taiwan's success relies on all the citizens. It's the efforts of the 23 million people. So the New York Times said that I am a weapon of Taiwan. So it's my honor to say that I am fighting this good fight with you. And why are 25? They chose three people. That's the people who are making things better. That's me, President Tsai Ing-wen, and Digital Minister Audrey Tang. And our President Tsai Ing-wen just said, well, it's not our efforts and achievements only. She said, it's not the trio, it's the people in Taiwan. Solidarity is the key for the success of COVID-19 containment in our country. I totally agree with her. And the president was chosen as one of the 100 most influential people by Time magazine. She said she would like to thank everyone in Taiwan for their efforts in combating COVID-19. It's a joint effort by every one of us. In the future, still, it's posing challenges for us. I think, well, I might need to correct the fifth point here on the slide. because it said effective and safe vaccines have not been approved, but maybe today or tomorrow we will have successful vaccines approved. So in terms of prevention or the new lifestyle, I would like to encourage again social distancing, personal hygiene, name-based gathering, and also working from remotely. And now we know that virus knows no national boundaries, and any virus might cause a damage to the world and even to national security and also regional stability and peace. So no country can fight pandemics alone. We need to help each other, and that is the key for the success of pandemic containment. We need to have national solidarity and move on to global solidarity so as to succeed and prevent the world from the damage and the harm. Taiwan can help. Taiwan is helping. We donated our masks, our PPEs to over 80 countries, and also we strengthened our travel alert and border quarantine, and we applied our information technology, ICT, that's information communication technology, and our AI technology to pandemic containment. To conclude, I would like to say that our success relies on these elements. First of all, our prudent action. Second of all, rapid response. Third of all, early deployment. Number four, transparency. And also, very importantly, solidarity. Finally, international collaboration. I would like to give kudos to every one of us. It's very great achievement done by every one of us. Finally, I would like to quote the Pope from Father Pope Francis. That's what he wrote to all the Catholics worldwide. I think this passage reflects our Taiwan value actually. He said, rivers do not drink their own water, trees do not eat their own fruit, the sun does not shine on itself, and flowers do not spread their fragrance for themselves. Living for others is a rule of nature. We are all born to help each other. No matter how difficult it is, life is good when you are happy, but much better when others are happy because of you. Actually, that's what Taiwan does. We love ourselves, but we love other people even more sometimes. So we live for others and we are having a happier life. Every cloud has a silver lining, as we know. In that silver lining, we have Taiwanese people's mercy and kindness, and Taiwan can help. Taiwan is helping for global solidarity. Taiwan's democracy, transparency, and freedom. Thanks to them, Taiwan is going toward a more free, a more liberal, and a better country. Taiwan is rising. Thank you very much. Thank you, former Vice President Chen Jianren. I am now feeling so proud to be a Taiwanese. I think we have very great time management today, so we can have 3 to 4 questions to raise to the speaker. And we will pass the microphone to you. If you have any questions, please raise your hand.
Thank you, former Vice President. I think that you give us a great overview about our pandemic efforts. After listening to your presentation, is there any risk for Taiwan that since we do not have a lot of inbound cases coming from around? And I noticed that for some countries, they're starting to take more actions after they suffer from the inbound cases surge. So do you think that we may overlook some of the risks here? In Taiwan, our hospitals, public facilities, or other entities are not impacted by the SARS experience. So pandemic efforts is a bit different from the disaster prevention efforts in other kinds, for example, natural disasters. So I think that in the pandemic efforts, um, human beings is the most important vehicles in the COVID-19 transmission. So for us, border control is now the most critical efforts in the process. But of course, we are a trade-oriented country, and our citizens have their rights and duty to come back to Taiwan. So we have to open our borders. So even though we have a lot of border controls since March, but migrant workers, citizens, and civil servants are still entitled to come back to Taiwan, and they will go through different tests. Starting from December 1st, they have to do PCR testing, and they have to go through 14 days quarantine before entering our country officially. So I think that this is a very important step. If we do not take a firm stance on border control, then the infection situations may get worse. And that's why we emphasize and continue on the border control. So since December 1st, we have more stringent regulations. If we cannot maintain a 1.5-meter social distance, then everyone's have to wear a mask. And when you're taking public transportations, you are required to wear face masks as well. And now it is important for governments in Taiwan to negotiate with all the vaccine manufacturers around the world. So if we have vaccine in the near future, everyone should take it. I think vaccination is very important. It's not just about the self protections, but you're also protecting other people. If we have the um, immunity level by 70% or 80%, if the virus comes into Taiwan, we can stay strong immunity. For example, my grandkids ask me that whether quarantine is effective or not. For example, if one person can infect 3 people in one day, so within 10 days, it, they would spread the virus to 60,000 people. So as long as you wear face mask, then you can see how affected by calculations. If you only transmit to 2 people a day, then after 10 days, they will only affect it about 1,000 people. But if they infected 3 people a day, they will infect it up to 60,000 people. So personal hygiene and personal protection equipment are really effective. So that's why it's um, puzzling to me that many countries in the Western world are resisting wearing face masks or maintaining personal hygiene. So I should really emphasize that quarantine and personal hygiene are very effective methods to ensure um, the pandemic from spreading. As according to the New England Medical Journal, that wearing face masks is a very effective method. So I'm really honored to work with 23 million people in Taiwan who have high civil ethics to wear face masks faithfully, and then I think it will be very effective to maintain this kind of efforts and measures. I'm Professor Wong from Donghai University. I'm teaching industrial design. We're now trying to build up the medical service system in Taiwan. And we know that smart healthcare technologies are emerging in Taiwan and growing very fast. I do think that we have the opportunities to promote all these smart healthcare technologies to different parts of the world, including prevention, treatments, diagnosis, etc. So, are there any other things that we can do besides sending out face masks to other countries? I think this will be a great opportunity to develop smart healthcare technologies as a leader around the world. I wonder, do you have any suggestions to us? Our health minister is working very hard, as well as the government. I think that sci- um, Ministry of Science and Technology is also working very hard. When our current ministers was the minister without portfolio, he had a as precision health project from 2020 to 2024. We hope that in the futures we can do precision healthcare, prevention healthcare, as well as participatory medicines as well. So the e-health system is very important. And in the pandemic this year, we are seeing the power of smart technologies. So we can have contactless healthcare and we can provide care and services without contacts. Even though we avoid person to person contacts, we can use remote healthcare and remote service. Even for isolations, hospital wards, they have the healthcare monitors to transmit the data and information so nursing professionals do not need to walk into these wards that frequently. And many patients can also wear all these monitor systems and devices. So the e-health system in Taiwan in the futures will not be limited to hospital or medical institutions. We hope that we can proliferate to other environments in Taiwan as well. We hope that we can promote them into the communities. If you encounter any accidents at home, then we do have healthcare professionals who will come for visits regularly. And physicians can also um, diagnose and also pay visit them in remote situations. The, this kind of healthcare system will be an important factor and component as long as as long along with our security systems in Taiwan, and we are responding to the aging systems, and we are seeing entrepreneurs are donating supercomputers so all the data can be aggregated together. Many countries around the world are doing e-health, but we need the test bed to verify the software programs and the systems. Because we have the national healthcare system data, we can be a very effective and efficient test bed. So that's why I believe and I agree to you that we can be a smart healthcare leader, and we can also develop and produce a lot of the smart service detectors and devices. So we do have a project in the government to continue on this effort. I'm sure that Ministry of Science and Technology as well as Ministry of Health and Healthcare as well continues to work on this. If we can combine ICT, AI, as well as other smart technologies together and integrate them into the healthcare systems, our systems will be transformed and will be renovated. We hope to evolve from precision healthcare, precision screening to even transitions healthcare system so people can stay healthy without frequent medical or hospital visits. We want to move from treatments to prevention. So that's what we can do together. And that's something that semiconductors can do in Taiwan, and we can also develop this industry in Taiwan. We have a lot of outstanding technology professionals and medical professionals. If they can work together, I think we can move forward. We open up for the last question. I'm from National Zhongshan University. People have talking about deployment and prevention and event. So if everyone can plan in advance, because we do have all kinds of religious belief in Taiwan, and we are researching on how do we handle deaths and dead body, and do we have a SOP or a standard procedures to think about how to process all the patients and when they with their disease. So back in 1999, we had a terrible earthquakes in Taiwan, and we are seeing that we are putting those deceased people in body bags. In 2004, we encountered the SARS epidemic. At that time, we actually improved on our measures and procedures to take care of this diseased body. And we also need to conduct autopsy to verify whether they are dead because of SARS. So besides the Ministry of Health, we also have the Ministry of Legal Affairs and Ministry of Justice to make sure that everything is done in a legal way. And that's why I agree with you that we need to improve on this. We always respect the disease. And I believe that we are improving. We are also preparing in advance. We are thinking about how we can take care of the diseased bodies and transport them and handle them in a more respectful way. But it is important to collaborate between ministries in the governments. I think presidents organized a very important emergency meeting back in January. And at that time, she invited many different ministries to participate. So all the ministries are aware of what they need to do. This kind of coordinated efforts between ministries are very important and very effective. At that time, back in January, we didn't think about how to handle the diseased bodies. As we see many cases around the world that um, they hospitals and entities are overwhelmed by dead bodies. It's a very difficult and challenging situation for them all of a sudden. Of course, that pandemic will have different surges and curves, even though we do not have all the efforts and all the methods to minimize the surge, but we can control them effectively. So how do we level off the epidemic curves? I think it's very easy as long as you maintain personal hygiene, you wear face masks when you are in public occasions, you can minimize the infection rates. These are very simple but effective solutions. I think that banning people from going to bars is not very effective. So I participated in a video conference with UK previously, and um, British congressmen asked me how many people are punished or fined by the process. And I told them only 0.3% are punished in Taiwan. Uh, in comparisons, in UK, only 25% of British people actually follow the government guidelines and requirements. So I would like to congratulate everyone for your efforts over the past 10 months. But now we're moving to the second stage. We hope we can continue to work together. Thank you. So I would like to introduce our sponsors, and we hope that all the directors can also participate the photo ops with our former vice presidents. I will end my director positions here, and we do have translations. So even though that our former vice president speak in Mandarins, but all our international guests and listeners are listening to English translations. I would like to thank our supporters from the Academia Sinica, and this event is organized by our Disaster Management Society and the Ministry of Science and Technology. We have the co-organizers, including the ICOE Taipei. They are connecting the APEC system. We would like to thank IRDR for your support. We also have the co-organizers, including the NCDR. I think that many people here are belong to the NCDR, the Disasters and Convention Center. We would also like to thank our core sponsor, including National Central University and the National Police University. Our sponsors, including the Water Resource Agency, as well as Ministry of the Interior. We also have corporate sponsors from the Fubon Insurance. I think that insurance can be an important factor in the disaster preventions and response system. We would also like to thank our sponsors, Sinotech Engineering Consultants. We also hope that CECI and more private sectors can participate in the process. So now we would like to invite our distinguished guest to come to the front and take a group photos together. So thank you very much for your participation this morning.
客家，来，咱 keep 下去。
我们上讲台会拍一个会比较好。